This is taken from an article by Cameron Smith titled COVID-19 Vaccine Pits Personal Choice Against Public Health. And I got it off the AL.com website, July 26, 2021. She talks about pitting non-vaccinated people against vaccinated people. She brought up an interesting observation. Quote, cigarette smoking causes almost 500,000 preventable deaths per year in the United States. If there is any science that's ever been settled, it's the reality that smoking has catastrophic personal health consequences. We haven't banned cigarettes. How about refined sugar, pornography, and alcohol? We shouldn't ignore well-established research about the impacts of each. Are we showing contempt for our fellow citizens by allowing consumption of these products? Should we mandate a flu vaccine every year? Such an order would undoubtedly prevent deaths even with vaccines we know to be only 40 to 60% effective. There are many such examples, like the decision to mandate the COVID-19 vaccine. Each of these is a balance between individual choice and what's best for an orderly society. Striking the ideal equilibrium is rarely easy. COVID-19 highlights America's ability to sort out quite difficult and intricable disagreements. We're at the point where arguing and information about the virus have essentially done what they can do. Patrick Henry famously stated, "Give me liberty or give me death." Many unvaccinated Americans may end up with both. This is Eric. Welcome to the craziness that lives inside my head. When my clients ask, do I have to wear my mask? I've been fully vaccinated. I always say no, but company policy is that I got to wear my mask. Then they ask, have you been vaccinated? And my response is no, but I wear my mask as much as possible even when I leave my job. I recently read this online, and this is by Government Mandatory. It was published July 30th, 2021, and it was updated August 1st, 2021. Quote, the Delta variant is much more contagious, more likely to break through protections afforded by the vaccines, and may cause more severe disease than all other known versions of the virus, according to an internal presentation circulated within the Center for Disease Control and Prevention. Dr. Rochelle P. Walensky, the director of the agency, acknowledged on Tuesday that vaccinated people with so-called breakthrough infections of the Delta variant carry just as much virus in the nose and throat as unvaccinated people and may spread it just as readily, if less often. But the internal document lays out a broader and even grimmer view of the variant. The Delta variant is more transmissible than the virus that causes MERS, SARS, Ebola, the common cold, the seasonal flu, and smallpox, and it is as contagious as chickenpox, according to the document, a copy of which was obtained by the New York Times. Interesting. Interesting. It makes you wonder, what the hell is going on here? The government may have mandatory vaccinations. They're talking about it now. You're going to vaccinate the people that are being vaccinated are spreading it, but yet you're pitting them against the unvaccinated people. And I mean, that doesn't make sense to me when they both are spreading it. It doesn't make sense to me, because if a person got vaccinated, he got the freaking virus. He or she is spreading it, opposed to unvaccinated people who may be infected or may not be infected. You don't know until they take the test. So the people who really are the problem are the vaccinated people. I mean, it just doesn't make sense to me. Now you may say, "Oh, Eric, you're crazy," which I am, but it just doesn't make sense to me. But then I don't like the fact they say the benefit outweighs the risk. What's the risk? The risk is, according to what they say, they claim that people who are vaccinated, even though they get reinfected, they don't the vaccination don't allow them not to be hospitalized or death. That's what they say. Even though there's a case in my state where a woman did die. She got vaccinated. She walked to her car and she couldn't breathe. They called 911 and she died. And they're supposed to be still investigating this death, but they claim that she didn't die of the vaccine. She died of the complication of vaccine because she was obese, she was diabetic, and asthmatic. Which is very interesting. And it's interesting because those are the first people they claimed they wanted to vaccinate because of the fact that they have health issues. Now, they're not saying that she died of the vaccine. They say she died of the complication of vaccine. That reminds me of the old days in the 80s. They claimed that you don't die of AIDS. You died of the complication of AIDS. Isn't that the same thing? Were they saying that back then with HIV? I'm not putting HIV together with COVID. I'm just saying the wording, the way they word things. So, these are my questions to the government on a mandatory vaccination. If a head of a household gets vaccinated against his or her will, then gets infected with the virus and hospitalization, is the government going to pay the bill? Next question. In those rare cases, they claim it's rare cases, where a fully vaccinated head of household dies from a breakthrough infection, is the government obligated to take care of the household's dependents? Now you're pushing people to do things that they don't want to do. I'm going to be honest with you. If I die from COVID because I didn't get vaccinated, that's on me. If you force me to do something against my will, and you force me to get vaccinated, and I drop dead because of the vaccination, that's on the government. I don't care what nobody says. Once you take away my ability to make a decision for my life, for my health, it's on you. I don't care what nobody say. And I'll give you a perfect example of what I'm talking about. Back in the 90s, those I've told you how I was always 400 some pounds. I was on, I'm not going to tell you the name after I finish telling you this. I was on this medication that was to help me to lose weight. And I was losing weight on it. And then, you know how it is. You lose weight, and then I stopped taking the medication, and I gained weight because I was eating ice cream, of course. Then I went back on the medication. I started losing weight again. So I went to the doctor, and I said, do I have to take this medication for the rest of my life? And she said, yes. And I explained to her, I don't want to take this medication for the rest of my life. And she blew up. She says, I'm a doctor. You're going to tell me what you're not going to want to take? I'm a doctor. I went to medical school and I went intern. And she just ran it over. And I looked at her like she was crazy. This is my life. This is my health I'm talking about. I have control over my life and my health. It's my decision. I said, no, I'm not taking it. Then a year later, that medication that she wanted me to take for the rest of my life, they took it off the market. It was fen-phen. People was dying from that, heart attacks. And now I'm not saying, you may say, well, it's a different situation. In my opinion, in my mind, it's the same situation. You taking away my ability to make my decision on my health, just like people who smoke cigarettes. It's the people today, I'm shocked, they smoke cigarettes. They know all about what we went through in the 80s and 90s about cigarettes. It causes cancer. People still smoking it. I don't see the government stopping them, taking away tobacco, just like the woman said. Just like sugar, refined sugar, diabetes, and all these other so-called diseases. I don't see the government stopping, shutting down the plants for making all that stuff. So now they want a mandatory, which is very interesting because the people who's making this vaccine are the pharmaceuticals, right? The pharmaceutical companies. Interesting, very interesting. Well, anyway, I want to say this other thing. Despite, I got this off the internet also. Despite the Black Death is the most fatal pandemic recorded, the study noted that 2/3 of Europeans survive. It sheds light on our own evolution. Norman said, there will always be people who have some resistance. They just don't get sick and die, and the human population bounces back. This was written on May 19, 2021. And with that, I'm going to end with this, what I feel. I have a funny feeling that there are people who can survive COVID-19 infections. I think they proved that already. In 2020, when people was going to the hospitals, they had to put them on ventilators. Well, the problem was that you don't have enough ventilators to put all these people on. That is the problem. The problem is you don't have the country don't have resources to take care of all these people that get infected, and those who have weakened immune system or weakened whatever and health issues, they die. That's what was going on. It's cruel to say this, but there's, people going to die. And you can save as many people as you can with what resources that you have. But the truth of the matter and the fact of the matter is people are going to die. People are going to live and people are going to die. That's the truth. And might say to me, "Oh, you so heartless, humanity." You can't save everybody. You can't. I've seen cases like we talk alcoholism. You can't save everybody. I know people who went to tons of rehabs and they still go back to drinking. You can't save anybody, and you watch them die. You watch them drop dead, which is interesting. I don't see the government is closing down the liquor stores. Anyway, this is Eric, and you've just heard the craziness that lives inside my head.